Hello there, my name is Mario Ibarra. I worked in Dr. Jones' lab on pulmonary arterial hypertension. My initial question is what factors lead to people having higher risk of developing pulmonary arterial hypertension?
Pulmonary arterial hypertension, or PAH, is an incurable cardiovascular disease. If left untreated, can lead to death. It is characterized by high blood pressure that affects the arteries in the heart and lung. Your heart pumps blood through your arteries and veins, sending oxygen to all parts of your body. In a single heartbeat, the left side of your heart sends blood out, and the blood also returns to the right side. The right side sends it through the pulmonary artery to the lungs, where it swaps the carbon dioxide for oxygen. The blood goes back to the left side of your heart, and the process starts again with the next heartbeat. It's a short distance from your heart to your lungs, so normally the right side doesn't have to pump very hard. But with PAH, the blood doesn't move freely through the arteries in your lungs. Your heart works much harder to force it through it. Over time, the heart muscle gets weak and it becomes enlarged and stops working properly. When your blood doesn't flow well, your body doesn't get enough oxygen.
The early symptoms are shortness of breath while exercising, fatigue, chest pains, and a racing heartbeat. As the disease gets worse, may also have fainting, swelling in the legs and hands, blue lips, and a dry mouth. The symptoms of PAH get worse as time passes by.
There are four mechanisms involved in PAH. First is vascular constriction. It's when the contraction of the muscular wall leads to narrowing of the blood vessel. Second is vascular remodeling. It is an active process of structural alteration. Third is into thrombosis. It's when clotting happens in the blood vessels. And fourth is vascular wall stiffening. It's when the wall gets so stiff that it doesn't allow the arteries to contract. All these factors lead to higher pulmonary vascular resistance and pulmonary arterial pressure, which will lead to right heart failure.
Although PAH is a rare disease, approximately 200,000 cases are seen every year.
PAH is more common among women, non-Hispanic, African American, and among people aged 75 or older. The factors that lead to higher risk of developing pulmonary arterial hypertension is having a family history of pulmonary hypertension, or living high above sea level, or having other lung or heart diseases, also clotting disorders or blood clots affecting the lungs.
There's no true cure for PAH, but there's treatments to help improve the quality of life of the patients.
The treatments for pulmonary arterial hypertension include oxygen therapy, physical exercise, visit to a cardiologist, a pulmonologist, or critical care doctor or primary care provider. Now that I learned about how the risk of PAH increases,
My remaining questions are if you're in risk of developing pulmonary arterial hypertension, what changes in lifestyles can be done to prevent it from developing? The other question, does exercise and a healthy lifestyle prevent the development of pulmonary arterial hypertension?